My name is Adrian Baddar. I'm an orthopedic surgeon at Hampton Orthopaedics and Sports Medicine. I was hoping to talk today a little bit about determining the source of pain in patients. That's one of the most important things that we do in our job. It sounds like a simple thing, but sometimes pain is not always where you think it's coming from. One of the examples I like to make is talking about patients' hip pain. That can sometimes present as knee pain or back pain. It's not always coming from the hip joint. An example of this is like when a patient has a heart attack. Sometimes they'll feel pain in their jaw, their neck, down their left arm. We know that the pain is not coming from their arm, it's coming from their heart. But that's where the classic pain is felt. And we know with the hip, the same thing can happen, but most patients don't know this. When people come to me with hip pain, one of the first things I ask them is, where's your hip? Because it's not just as straightforward. Some people will only feel that pain down at their knee. The classic pain will be felt in the groin. It can be felt in the buttocks. The same thing with knee pain. Sometimes that can only be felt in the calf, down at the ankle. It's not always coming from where we think it's coming from. So one of the most important things that I do in my job is trying to figure out where that pain is coming from. We don't want to waste time treating the wrong body part. So sometimes that means doing examinations to help determine where the pain is coming from, see if we can single out, is it the knee, is it the hip, is it the back? Even between the shoulder and the neck, that can be an issue. Sometimes that'll involve doing diagnostic studies to see where that source of the pain is. MRIs, X-rays, other modalities. One of the best tricks that I have is the ability to place injections into a particular body part and make that body part and only that body part go numb. For example, if I think their pain is coming from the hip, I can do a diagnostic injection into the hip joint and make that hip go numb. That will only make the hip go numb, not the skin around it, not the muscles around it, just the hip joint. If that takes away their pain, then we know where that pain is coming from. We know it's from the hip. If that pain just takes away a portion of their pain, we know that portion is due to the hip. If that pain is not relieved by that injection, then we know that the hip is not the source of the pain, and we should look elsewhere to determine that.